Together with me is Shlomy Rubanenko, the sales manager of Strauss Co. And Shlomy, I wonder if you can tell me a little bit about your company.
We are celebrating 53 years this year. We are selling our rotary instruments in over 76 countries around the world. We offer a very high quality product, and we also offer a lot of product for specific niches in dentistry. We are a family-owned company, and we are very proud to be flexible and very customer-oriented, trying to fit the needs of every different customer.
So we all know, Shlomy, that the rotary instrument markets are very competitive. And I wonder if you can share with us what are the leading trends in this domain.
We see today that a lot of dentists are going into a more specific niche. Every dentist is doing today a much more specific work. There are dentists today that only do laminates. There are dentists that only do surgical, that only do orthodontics. And we do see today a specialization in a specific niche that a dentist is doing more and more of the same of a specific work. In our standard offering, for example, we have more than 3,000 items. If I'm giving it for a specialist dentist, the full catalog, it will get lost. We are trying to give every dentist a specific customization of his needs and to offer a very limited line that can answer the needs of his day-to-day work. And the most important thing is that every dentist can see, can try, can choose the correct item for the application. And it's okay to try. It's okay to check what is good for him, what works best in his hands, and afterwards do it on a routine on his practice.
Shlomy, I would like to ask you as an expert in this field to offer some advice or maybe some strong tips that you can suggest for a dentist or a GP. What kind of tip you can offer them?
We usually see that the dentist is using in the day-to-day work what is used to do in the university. He's learning the procedure in the university and then he's doing the same procedure in exact same tools in the day-to-day practice. We offer that the dentist will see different items that are in the market, see different approaches to this, do the research, check, experiment, and only afterwards decide how he wants to work, what is the best tool for him and what is the best procedure for him.
Thank you very much, Shlomy, for finding time for this interview because I see there is so much action that is going here. It was a pleasure having this discussion with you today.
Thank you, Ozzy. It's always a pleasure to see you, and I'm looking forward to see the video, how it's ended up in the Wizard of Ozzy.